all of a sudden COVID was our life. Working at a hospital, you always know that no matter what happens in the world, you're going to work. Like, there's a hurricane, you got to find a way to come in.
So many of these patients, once they got to the point of having to get intubated, didn't survive, no matter what we did. And it was very difficult mentally that we couldn't save patients.
When my boss passed, I was home that day, and then to come into work the next day, that was probably the hardest time of this whole thing. We lost 3 people in the department. I worked with them since I started there, too. I don't think anybody got a chance to properly grieve. We still had to work. I didn't sit down for like 13, 14 hours straight. You had to put it out of your head, I guess. I still hate thinking about it to this day.
Things that are emotionally and psychologically traumatizing affect healthcare workers as well. But the culture hasn't always been about acknowledging that. The Helping Healers Heal program, or the H3 program, was created to provide emotional and psychological support to frontline healthcare workers, to support staff through potentially traumatizing events.
I see you, I see how hard you're working, and I want to acknowledge it's hard, and I want to be here with you, and I want to listen. And sometimes people would break down in the hallway, and they would share what they'd been through the last hour, 3 days before, what was staying with them, what was haunting them. It was just a way to tell people you're not in this alone, and that was really what it became.
Once things started to take a downturn with volumes, the H3 team would set up chairs outside of the emergency department. Just hearing how everybody else was struggling, assimilating with society, how they felt coming to work made me feel like, okay, so I'm gonna get through this too. We're all gonna get through this together. I was able to talk about it in a very open, welcoming, warm setting.
When I got to move back upstairs and see my family again, that was my best moment. That was after like 3 months. In the beginning, it was really short. Then, little by little, the fear is less. And I took like the antibodies test like 2 or 3 times. I have no antibodies. I said, we got to live our life again.
I don't think anybody's going to be the same after this experience, but are they stronger and more tied to their resilience and being able to lean on their colleagues and families to be able to say, that was really tough, but this is how I've healed from it, and this is how I'm stronger.
Out of the hardship is where we grow. And I think that has been the mission, really, of Helping Healers Heal. Trying to do more. We're trying to, band together and process and work through this to be better on the other side.